Hi, I'm Dr. Martha Boone. I'm a private practice urologist in Atlanta, Georgia, and we're going to talk for a few minutes about kidney stones. As a urologist, when I'm called to the emergency room to see a patient with a kidney stone, I don't even have to ask which patient is mine. It is the one who is obviously writhing in pain. People who have passed a kidney stone will tell you that it is more difficult than having a baby. The stones form inside the kidneys, pass down the ureter, into the bladder, which is a storage organ, and out the urethra. So they have a long path to follow. Kidney stones form inside the kidney. The top part of the kidney is very large, so rarely would you get any pain from a stone that is just in the kidney. The pain starts when the stone goes down this tube, which gets progressively smaller. This tube is called the ureter. As it enters the bladder, it's about the size of a straw and is the consistency of moist tissue paper. It almost always holds up in this area. And the pain that comes from kidney stones comes from something called renal colic, which is a fancy word for the stretching of the capsule around the kidney. Kidney stone pain can cause you pain up under your lungs. It can cause pain in the front of your body. It can cause pain in the back of your body. It can cause pain anywhere along the path of the ureter. In male patients, it can cause pain in the penis and pain in the testicles and pain in the groin area. In women, there can be pain that actually feels almost as if it's coming from the ovaries or the uterus with passing of kidney stones. Now, there are lots of different types of kidney stones. If you look in your family tree and you have a lot of people who have passed kidney stones, then you most likely have either calcium oxalate stones or uric acid stones or cystine stones. The biology of stone formation is very complex, so I will try to give you an extremely simplistic idea of what goes on. If you have inherited a metabolic problem that causes you to make kidney stones, it can be either that your body is absorbing things abnormally from your gut in the food and vitamins and minerals that you've taken in, or your kidneys are processing things improperly, or there can be glands in your body that can cause you to process calcium and uric acid improperly. So there are multiple parts of your body that can actually be participating in the stone formation. If you were going to ask me the single best thing to do to keep from forming kidney stones of any type, it would be to drink an adequate amount of water. Now, the amount of water that you need to drink depends on your height and weight, and it also depends on your activity level. If you're running marathons, you need a lot more water than someone who has a desk job. If you weigh 100 pounds, you need a lot less water than someone who weighs 250 pounds. If you are a person who eats a lot of salt, that can cause you to form kidney stones. So anybody who eats salt is going to need to drink a lot more water. In general, the amount of water that you would need to drink is your body weight divided by 2 in ounces. So let's say you were a 200-pound person. We would divide your body weight by 2, so in general you would need about 100 ounces. The best thing that you could do is drink this water around a 24-hour cycle so that you have to get up to urinate at least once during the night. If you want a layman's idea of how to tell if you're drinking enough water, when you look into the toilet, your urine should be the color of pale lemonade. If it ever gets dark, you are dehydrated, and that is a time where you are likely to form kidney stones. The southeastern part of the United States is called the Stone Belt. We have more kidney stones in the southeastern part of the United States than anywhere else in the United States, and we don't really know why. We think it is due to the climate. We have more months where people are perspiring and where the temperatures are high than we have in the more northern parts of the country. Some people have hypothesized that it has to do with the drinking water, but nothing has ever been proven about that. As far as we know, there is no type of water that is better than any other to drink to prevent kidney stones. Some patients will have dietary concerns that can cause them to make stones. An old theory is that eating dairy products will cause you to have kidney stones. There's a lot of data out there that indicates that that is not true. If you have repetitive kidney stones, you need something called a metabolic workup. What we do is we order about 30 blood tests and we get about 20 urine tests so that we can analyze exactly what's going on in your metabolism that is putting you at risk for making stones. This is pretty much the only way to stop chronic stone formers from making stones other than decreasing salt intake, decreasing red meat intake, and increasing your water intake. If you go to our website, femaleurologist.com, you will see a recipe on there for a lemonade concoction that helps prevent stones. I learned at a recent metabolic stone meeting that there has been a lot of scientific study done to demonstrate that this particular lemonade product increases citrate in your urine, which stops the stone particles from sticking together. Citrate is called a stone inhibitor, and the lemonade recipe on my website provides citrate to your kidneys, which decreases the likelihood of your forming stones. Now let's talk for a few minutes about what we do when you have a stone. Let's say you're that poor guy in the emergency room writhing in pain. If you have a stone that is stuck along the end of the ureter and we can see it on a plain x-ray, then we can do something called lithotripsy. What we do in lithotripsy is we have you lie on a bed, we do an x-ray so that we can see exactly where the stone is, and then we focus shock waves onto the stone to crack it into pieces to allow you to pass it easier. If we're lucky, your stone will break to dust and you'll have minimal pain in passing it. If you have a particularly hard type of stone, it may break into large pieces and still be difficult to pass. And if you have a very, very hard stone, we may do lithotripsy and your stone may not break. This happens rarely. If you have a large stone that is near the top of the kidney, we would definitely try to do lithotripsy. And if you look this up on the internet, it's called extracorporeal shockwave lithotripsy. And extracorporeal just means outside of the body. Now, if the stone is completely stuck in the ureter and is blocking your kidney from producing urine, this is an emergency. Your urologist will need to unblock your kidney. One thing that we might do is to stent your kidney. What we do is pass a little piece of silicone tubing, it looks like a little fat piece of spaghetti, around the stone to allow the urine to come down the stent and unblock the kidney. Occasionally, this will passively dilate the ureter, which will make it easier for you to pass the stone. Frequently, we will do something called ureteroscopy. We take a very thin scope, go up into that ureter tube, and either break the stone up with a laser or trap it in a basket and bring it back down. Just about all stones can be treated without major surgery. Luckily, I have not had to do open stone surgery where we cut the outside of your body since 1988. Even bigger stones can usually be treated with minimally invasive techniques. If you were to have a very large stone in your kidney, we would do something called a percutaneous nephrostomy. We would put a big tube on the outside of your body and pass it into your kidney. Then we could take a scope and go directly into your kidney to use a laser to break up the stones and to bring the pieces out using a basket or using a suction device. So there are a lot of real high-tech operations involved in kidney stones. Luckily, we don't have to open people up anymore for the most part. And the metabolic workup and evaluation is very key. If you've ever had more than one kidney stone, you should definitely have a 24-hour urine and a series of blood tests to help discern why this is happening to you. Of note, most people with kidney stone disease do not develop kidney failure. If you repetitively pass stones and we were unable to get your metabolic condition under control, theoretically you could have damage to your kidneys. But most of the time, this does not occur. Most of the time, we're able to get the stones out without causing any damage to your kidneys. So thank you for your attention.